Hello, my name is Salka Cosme, and I'm a medical student at the Kirk Kerkorian School of Medicine at UNLV.
My name is Melanie Shackleford, and I'm also a medical student at the Kirk Kerkorian School of Medicine. We're presenting on in-person versus online, problem-based learning as a method of teaching Asian American Pacific Islander issues in medicine.
For introduction, the COVID-19 pandemic prompted medical schools to use alternative ways in delivering educational materials, specifically utilizing virtual options. As medical students, learning and understanding cultural differences is a core principle in cultivating professional physician-patient relationship. Our aim with the study is to examine the efficacy of virtual settings. We compared virtual and in-person didactic sessions in teaching about Asian American Pacific Islander, otherwise known as AAPI, cultural and health issues.
We administered an anonymous survey via Google Forms before the session. This survey, shown in Figure 1, asked students their comfort level with AAPI health issues and cultural issues, with 5 being very comfortable and 1 being not comfortable at all. We administered a second survey after the session. We asked students again their comfort levels regarding AAPI health and cultural issues. We also asked them to rate the session overall and whether they would prefer the session being run virtually or in person. We collected the means for the questions which asked students their comfort levels regarding health and cultural issues. We performed an independent sample t-test comparing the means of responses before and after the session. The differences between the pre- and post-session responses were statistically significant. Figure 2 is a bar graph comparing the means for both questions. Gray indicates the pre-session means, and red indicates the post-session means. Table 1 includes the means as well as the p-values given by the t-test. We also performed a linear regression analysis to determine whether students' preferences for virtual or in-person learning affected their overall ratings of the session. This test was non-significant with a p-value of 0.82.
To summarize, both in-person and virtual problem-based learning didactic sessions are effective methods in delivering minority health-related topics to medical students. A high pre-assessment comfort could be attributed to earlier exposure of these topics during a student's pre-clinical training. Limitations include a small sample size and variability of time lapse between when the pre- and post-didactic survey were filled. To conclude, regardless of preference of in-person or virtual settings, didactic sessions improved students' level of comfort in both AAPI cultural and health issues. Further research should be aimed at looking at long-term effect of this session on medical students during clinical years and if retention of information is preserved. Thank you for your time.